Did you know that there are about 2.6 million people in the United States with schizophrenia, and over 40% of them go untreated? Schizophrenia is a brain disorder that affects how people think, act, and express emotion. According to the World Health Organization, schizophrenia is found all over the world. However, it is one of the least common disorders. This disorder is actually very interesting. First, we will talk about what schizophrenia is, then we will discuss the history and what causes this disorder. Then we will talk about the treatments. So what really is schizophrenia? People with schizophrenia often experience many symptoms that affect how they can live and function. According to an article by American Psychiatric Association published in 2021, these symptoms include having hallucinations, delusions, trouble with speech, trouble with thinking, and lack of motivation. The hallucinations can range from hearing or seeing things that aren't there, but the most common is hearing voices. In an article by FISM, published in 2021, it says that some people with schizophrenia have something called anosognosia, which literally translates to not know a disease, which means they have schizophrenia without even knowing they are mentally ill. Many studies show that men are more likely to have schizophrenia than women. Men are also more likely to develop schizophrenia at an earlier age than women. There is not much known about the difference in symptoms for men and women, but some researchers suggest that men have more negative symptoms, but women have more affective symptoms. Most people with schizophrenia are no more dangerous than normal people. However, sometimes symptoms can cause some people with this disorder to be dangerous. In another article by American Psychiatric Association published in 2021, they say that some people with schizophrenia end up homeless or living in hospitals. However, most people with this disorder live with their families in group homes or even on their own. So for the most part, people with schizophrenia are most likely harmless. Schizophrenia dates all the way back to 1887. MentalHealth.net states that in 1887, Dr. Emil Kraepelin created this first formal description of schizophrenia. To describe the symptoms, he used the words dementia praecox, which means early dementia. Dr. Kraepelin believed that this illness was an early onset of dementia. However, schizophrenia and dementia are two different illnesses. Eugen Bleuler was the first person to use the term schizophrenia. Schizo means split, and phrenia means minds. He used this word to convey the mental confusion that comes with this disorder. It was not meant to convey the idea of multiple or split personality, and those two still get confused to this day. According to an article by the Mayo Clinic published in 2021, the exact causes of schizophrenia is not known. However, researchers believe that is a combination of genetics, brain chemistry, and environments that cause the development of this brain disorder. Studies have shown differences in brain system and central nervous systems in people with schizophrenia. Researchers are not certain on the significance of these changes, but they conclude that it is a brain disorder. To be diagnosed with schizophrenia, the person has to show two of the main symptoms stated earlier, including hallucinations, delusions, disorganized speech and behavior, and hyperactive behavior. There are also many tests that can be done to diagnose this disorder. Doctors will perform psychological evaluation and complete a medical exam. They even sometimes take blood tests to make sure that it is not drugs or alcohol causing the symptoms. Then they will monitor the symptoms to rule out any other conditions it might be. Lastly, we will discuss how schizophrenia is treated. The treatment for schizophrenia is lifelong. The treatments consist of psychotherapy and medications. The medications that can be taken are antipsychotic and anti-tremor medications. The psychotherapy can consist of rehabilitation support groups, behavior therapy, and group psychotherapy. There is no way to prevent schizophrenia. However, there are certain precautions that can be taken to prevent the symptoms from worsening. The main way to help it from getting worse is sticking to treatment plans and going through psychotherapy. If schizophrenia is not treated, severe complications can occur. These complications include depression, anxiety, abuse of alcohol and other drugs, social isolation, and many more. These complications can severely affect how a person lives. In conclusion, schizophrenia is a very interesting disorder. First, we talked about what schizophrenia is, then we took a deeper look into the history and what causes this disorder, then we discussed the treatment. Even though the chances are low, there is still that 1 in 100 chance of getting schizophrenia.